here in South Louisiana, anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting. So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
All right. Good day, my friends. Welcome to the July episode of Tea with Dr. D. The year is flying by. Tonight, I'm drinking a little bit of green tea with some local honey, thanks to one of my amazing patients that has his own bee farm, beehive. And so he gets local honey. And so I try and work that in as much as I can, as long as that keeps me in, moderate sugar intake. But welcome to the show. I do this every month just to answer questions about health, about healing, about any of that stuff. It's something we started like 6 years ago. We started doing this and just kind of bringing information out and answering y'all's questions. So if you got questions, drop them in there. You can text them to me. You can just drop them in the comments if you're watching this, or if you're listening to this later, you can text it to 801-691-7582 and those come straight to me. So very good. We got a bunch of questions texted in and asked over the last little bit about spine health and disc healing. And that's one of the things whenever we kind of look at this, there's a lot of misconceptions. So we pulled quite a few of the questions that y'all had around, discs and spine and healing. And so we're going to talk a decent amount about disc healing and spine healing on the show today. But if you have any other questions, let me know. Drop them in there. I think, this is a topic that a lot of us need answers on, a lot of us need to clear up misconceptions on, and we want to get accurate information out there about what the disc is, how it heals, and all of the things around disc healing. So let me clear some of these things up. I'm going to put this in. So if you're joining, we want to make sure that you have the chance to get your questions answered. So make sure that you drop a comment, say hi. Let me know that you can hear me is always a good point, and we'll dive into some of the questions on here. So a friend of mine had asked a good question here fairly recently. And it was basically like, what could y'all do to improve healing from a disc injury in the neck? FYI, I was told I need injections soon and then surgery if they don't work. And so this is a great question around, what can be done for a disc injury? So the first thing I wanted to do on this is kind of break down like what the disc is. So the outer layer of our disc is fibrocartilage. It's like the tire, right? It's very thick. It's this dense outer ring of tissue that like really is very tightly arranged protein fibers that create the rigidity around the outside of the disc. And its job is to kind of hold the inside of the disc in together so that we can have these shock absorbers up and down our spine. The inside is that like core nucleus, the little jelly filling that we talk about, and it's mostly made of water and like loose fibers and gel, so it can be a shock absorber. So the outside of the disc, that annulus part, is the fibrocartilage part. And the problem with fibrocartilage is it doesn't get a lot of blood flow. So when everybody talks about fibrocartilage, it's like, it lacks a blood supply, and that makes it really tough for it to heal because those healing cells can't get there very well. So when we look at something like this, the first thing I would say is we need to accomplish a few things to get a disc to heal. We need pressure off of the injured spot of the disc. So we need to make sure that we can relieve the pressure, because if that annulus part of the disc is torn, think of that as like a cut inside. I at least need to take pressure off of it so the body can kind of stitch it back together, if you want to think of it like that. It needs a signal to be healing it. Now, right when we herniate a disc, or right when we injure a disc, like I step and I fall and something happens and it bulges out, I have an internal signal to tell my body to go and heal that. The longer that goes, the lower that signal often comes through, and we need to restart that signal. So you've got to have a signal to heal. And then we need to take the pressure off, and we need scaffolding or material to get to the disc area to help repair it. And we need energy and blood flow. I know that's a lot, but if you break that down and we like dissect all this, it starts to make disc healing fairly easy. How do I take pressure off of the disc and keep it off? We can do some decompression stuff to keep the pressure off of the disc, but in terms of like spinal decompression, I can also start to build up the stabilizer muscles around my spine, and they kind of act like a little corset. So they like open the disc space, so I don't have pressure squeezing down on that disc, so I'm not reopening the cut of the disc, right? The other thing that I can start to do is if I'm looking at a signal, there's a lot of things I can do to use to turn the signal back on. So I can do medical needling that goes in and tells my body to restart the healing process. I can do injections. The act of putting the needle in stimulates a healing process, plus whatever you're injecting kind of opens that up and stimulates a bigger healing response. There's times where I can do certain types of slow loading exercises that stimulate a healing response if it's kind of mild. But we can start a healing response reliably. We know we can do that. Let's talk about scaffolding. If I break that down, how do I get scaffolding to build new cells on? When we look at like doing something like fibrocartilage is made of a bunch of like protein, and we can get the raw materials there if we're doing the right thing from a nutrition standpoint. We tell everyone who's trying to heal a disc, increase your protein intake. You're going to need that to help build some of the tissue. Very often we want people to start taking like a collagen supplement because it helps get some raw material in. We do use a lot of peptides if we're talking about trying to heal a disc injury, because a lot of the peptides help with vascularization and creating a healing environment and a scaffolding to repair a disc. So if you look at some of this stuff, you're like, we could dissect the healing signal that you need to repair a disc, taking the pressure off of the disc so it can repair, creating a scaffolding. And then for blood flow and energy, there's three things that work really well for this. High intensity laser into a disc space is really powerful to turn on the repair capacity of the fibrocartilage in your disc. So high intensity laser for a disc, guys, is really helpful. So is something called PEMF, PEMF therapy is very, very helpful to get in and like create a very good blood flow into the disc space. And then something like hyperbaric therapy that pushes blood flow in all the disc spaces and those deeper tissues can really help this repair process if we're talking about what we can do for a disc. So in our office, Walter, what we do is like, let's start by figuring out what's actually driving your symptoms. Is the disc injured and that was it? Or was the joint being compressed by muscles? Those muscles guarding, or was there weakness that led to pressure on the disc? So my muscles are supposed to keep me up, but they didn't. And that's why the disc started bearing the load and it weakened the annulus. If we look at what is the joint moving in the right position, are the muscles functioning well, is the pressure across the disc balanced, then we can start to identify why the disc got injured in the first place. Then we just go in and break down those steps to actually heal the disc. Turn the signal on. So we would do something like needling to actually turn it on, do some decompression style, like whether that's spinal decompression, traction. Make sure you're getting energy into the disc to heal. So if you're listening to this somewhere, I find PEMF or find laser therapy that can actually get energy and blood flow to the annulus of the disc so it can repair. And then we need to start slowly adding the function back to that area. So this might include, like, as we're doing that, this might include some peptides that help a lot. When we look at regenerative support for disc healing, I think things like GHK copper is an oral or injectable peptide that not many people are talking about, but it creates tissue scaffolding. That's what it does. Now, a lot of people talk about it for the skin, but I'm like, that's like the superficial part. That's great if that's what we need. But like, how much can that help us grow and repair the annulus of the disc if we do the right things? Really helpful to combine that one with BPC 157 that controls an inflammatory process around the disc, and TB4 or TB500 to help with like vascularization and repair of the disc. If we do that and we're controlling inflammation and decompressing, you can heal discs very, very well. When we look at that, even in the neck, like this is one of the areas we see great improvements for people. And I'm not saying injections are good or bad. They sometimes are a bridge to what I was just talking about. If you're so locked up and everything's painful, there's times where we'll ask for injections just to get you out of that like really guarded, painful, inflamed state, because that's what is kind of perpetuating some of the restriction across the disc. So injections can be good. There's a place for them. I think when we do the right things in the tissues as early as possible for disc injuries, we should get to a point where we are doing less surgeries than we are now. Not saying they're never going to be used, but they really will become something that we can build healing around, so that we don't need them except in these like really severe cases. So I hope that makes some sense. We kind of break down the components that you need to heal a disc. And when you do it that way, this becomes something that's very achievable. So I hope that helps, Walter. I know we've talked about this a little bit, but hit me up. Let me know if that makes any sense and what questions you got on any of that stuff. So, hey, Heather, how are you? We're answering all questions, but we got a bunch of questions on spine and disc injuries. So that is a little bit of the focus, but let me know what you got. I know they'll probably throw that up in a little bit and we can take a look at it. All right. Let's see what we got. Hey, Lily asks, I've got 4 herniated discs in my neck and spine. Any tips to help with the pain from these and address the symptoms in my hip? So some of this is a little bit kind of more of the same. When someone says I have 4 herniated discs, I think there's initially like a fear response. Like I get afraid of that. Like, oh my gosh, my spine is bad. I'm fragile. I have all these problems. The first thing I want you to know is like the number of herniated discs does not really tell us how much pain or how you should function. So like know that there's many people who have multiple bulging discs or herniated discs, and our bodies are so good at adapting to those things that you can still get to be pain-free and functioning very, very highly with that. MRIs are helpful. they don't tell us the whole story. They don't tell us where symptoms are coming from. They don't tell us what movements are related to that. So what we would want to find is which of your discs are symptomatic when we compress them and irritate them. Like, you know, are they actually irritating nerves? Are they creating some inflammation around them? Or are they stable, kind of like, you know, healed segments? That matters, because like if you try and attack this whole picture, you're going to kind of feel, you know, like, you know, paralyzed by the size of it. If we break this down and we actually find out, hey, only one of your discs is actually a problem, then it becomes, again, we dissect the problem into its smallest parts. It becomes very easy for us to heal one of them. If you're having pain in your hips, you don't say where the spine is, but it's like, it sounds like probably one of those discs in the lower back is causing some radiating pain into the hips. So it might be that we only need to go and address that one to get you functioning at your goals, feeling great, and like doing everything that you want to do. Your body could be protecting around those discs and tightening up and causing some like compression of the nerves going into the hips. We see this a lot where like a herniated disc in the back causes spasms of your QL muscle, your quadratus lumborum muscle, and that tightens up, and it actually pinches not the nerve coming by the disc, but the nerve coming over the top of your hip called your cluneal nerves. And if we just release the tension around that quadratus lumborum muscle, all that nerve pain in the hip goes away. Now, this depends on where it's at, like where in the hip, but it is something I see a decent amount where it's like most of the pain that somebody's feeling is not coming from the disc. It's coming from the body's response to that. And if we just take the pressure off of that cluneal nerve bundle, the pain in the hips goes away. And now we can start healing the disc without, you know, a bunch of pain going into my hip. So that's something to think about. I do think it is very possible that if we reduce compression, we loosen any of the muscles that would be guarding along the edges of the spine, calm nerve sensitivity. I've talked about it quite a bit on here, like PEA from a pain reliever standpoint for nerves is very effective with this stuff. If you've got inflammation around the nerves, PEA is something called palmitoyl ethanolamide. It is a compound that reduces nerve inflammation. There's quite a few studies of like high doses of this stuff. But, you know, that would be something I would start to pull in. Now we get it put in with some of the peptides that we use for disc healing so that it's like you just take less pills, right? But one of them you take like gives the inflammation. So we would put BPC 157 in there, TB4 that helps with the vascularization of the disc. We talked about GHK copper earlier to help rebuild the outside of the disc if we know that the annulus has been damaged. And there's PEA in that to help reduce the inflammation and pain coming from the nerves being kind of swollen and inflamed. So we go back through that, get the pressure off, create a signal to heal that area, reduce compression on the disc, and then gently start to add pain tolerable motions across the spine. So your body knows that disc needs to be resilient. It needs to be healthy. And then we want to start building the strength around the whole spine through the deep abdomen, that transverse abdominis muscle, through all the QL and our lateral oblique muscles, and then through the paraspinals and deep multifidus that stabilize the spine. So that's the process I would go through, Lily, is like thinking through it like that. You know, I know on the surface you like hear that and it creates this like, you know, gut fear response, but hopefully that helps you kind of dissect that and bring that down, get a really good assessment from a doctor who can break this down into like movement, palpation, and disc loading to find out actually what discs are symptomatic for you. So I hope that helps. There's so much fear around this. This is why I wanted to have one where we talk about this, because there's a lot of fear around these things and it doesn't have to be. So I hope that helps. If you have further questions, let me know for sure. Would love to. dive in and kind of workshop some of that stuff with you. So let's see what you got, Heather. After a DCE and a SAD procedure, is there a possibility of re-injury a year out? What kind of injury is most common? We do see, I mean, look, the highest, take this the right way, everybody, the highest risk of a injury or a problem in an area is a previous history of an injury and problem in that area, especially surgery. The highest prediction of back surgery is a previous back surgery. So I know this is like we're switching over, right? But when we look at some of these things, we are working through how deep in that healing chain did we go, right? So when we initially have like a procedure or something done, get the inflammation under control. Then can I get the motion back of the tissue? Then can I get the joint and the like function back? Then can I get the muscle coordination? Then can I get the muscle strength? And this is where my tissue starts to become resilient, where I can start to kind of move it and stress it and pull on it, and it doesn't just get re-injured. So very often whenever I see somebody like, after, a surgery or something like that, re-injure it, what I would say is that they probably didn't get all the way up that healing chain to where that tissue was resilient enough. And look, like when you do like a shoulder decompression or something like that, I think me and you have talked about this. It's a slow process to start rebuilding all the little strength around the shoulder. And I went on and off for probably like 6 to 9 months of doing very slow. I wanted to have some high repetition strength in every range of motion of the shoulder: flexion, scaption, abduction, extension, internal and external rotation. And like, I would sit in front of a mirror at the gym and just do these really slow controlled motions with a lot of focus to try and get full motion without pain. And I had to stabilize everything in that shoulder. This is what we teach people. Like, we've got to put the work in on shoulders to get it to where it's stable in every motion, or that tissue is not going to become resilient. So, I hope that helps. I know like any of these cases can be like, a little esoteric when we're not putting our hands on you and like looking at it. But, that's how I would think about this, is like, let's go back in. What tissue's involved? What's it feel like now? Was it an actual re-injury, or was it just like part of, the body trying to repair after a surgery from previous history of injury? And it just didn't get deep enough in that repair cycle. We didn't go through, get all full motion of the joint and the tissues, and then start to coordinate the muscle activity in the shoulder. There's a lot of muscles that need to fire. And then can I start to really strengthen all of those muscles? That coordination part is so slow. It's just boring. You're in the gym, you're doing very slow motions and high repetitions. My shoulder day took me, an hour in the gym, and I felt like I did almost nothing because it's such slow motions and you're just sitting there doing it. Now you get all kind of burning and soreness and stuff from it because you're firing in, these really slow patterns. But it can be really, really helpful if you're like, okay, I'm going to take 3 months, and until I get every motion my shoulder needs to do pain-free at 30 repetitions using like 2 pounds, it's all light stuff. I'm not moving on. And if you take it like that, the shoulder does a really good job of stabilizing itself and getting stronger. So, quick aside, for everyone, but if y'all, that's what I'm here for. If y'all have questions, let me know. We will definitely, dive into them. Let's see what else we got. Chase asks, how do I know if my arm or shoulder blade pain is coming from a disc? Okay. The short answer is like, based on location alone, we don't know. Like, just if you say like, I'm having pain here, is it coming from a disc? Anyone who answers that question is guessing. That's not how this works. a disc in the neck can definitely refer into the shoulder and down into the shoulder blade, like coming down the spine. And I have seen some of that. But muscles, there's quite a few muscles and joints that will refer that same pattern. So when we look at that, what we want to know is if we compress the disc and press into the disc space and force that disc to kind of like bulge out, and we find different ways of loading the disc, does that create a similar pain? Does that like create that pattern? If that creates numbness, tingling, burning, aching in that pattern, then chances are the disc being compressed is what's causing the pain in there. And then if we offload that disc, does it help remove some of the pain? Does it calm some of that down? When we do that, like one thing you could do is like, if you look up and over towards the side that you're doing it, and you let your head kind of sit in that space and almost like work it around where you're compressing the edge of that disc, does that cause it to go down through there? If that does, then it might be that you're loading the disc and the disc is causing it. In another aspect, and this is generalizations, like, we could do some tests and find out that this is positive and it is coming from the disc. But if you pull down and across and that causes that pain going down into the shoulder blade, there's a lot of muscles that attach up in the neck and run down and attach on the rib cage under the shoulder blade. And if we pull on those and it increases it, chances are it's actually coming from the muscle tissue. I'd say caveats because it's like the disc could irritate those muscles. But then again, your pain is coming from the muscles, not the disc in that situation. So it's a lot easier for us to just knock out the muscular pain, and then we can go about healing the disc without you hurting. You still got to heal the disc, or you still want to, but it's much less painful and uncomfortable going through the process if we get all the muscle and nerve irritation down. Even an MRI in this situation doesn't answer what your pain causing tissue is. We use it as part of it, but the exam is what tells us everything. The motion of your neck and the compression of the disc is really the thing that answers this the most. But you would also look at reflexes and strength and sensation patterns along that, to know, like, at shoulder motion, am I getting a lot of restriction in the muscles that run from my shoulder across the spine or to the neck? Would give us some good answers. Is it coming from a disc, or is it coming from muscle attachments around the shoulder blade? So that's how we would think through that. Y'all know this. I'm such a big fan of getting a good physical exam where someone's moving things and pressing on things and like checking motions, because it gives us just more information than even a high quality picture like an MRI does. They're great. When you put them together, that's where we get a lot of the power from. So I hope that helps. And then we go about, like what we've talked about on this a lot, then we go about how do we heal this, break it down into its components, takes the pressure off, build scaffolding, get a signal, get blood flow in there, and then start to rebuild function and resilience in there. So hopefully that helps. Sandra L asks, every time my neck starts feeling better, I do one wrong thing and it flares up again. Haven't we all felt like that, Sandra? Is there something wrong with my surgery? Okay. Or am I moving wrong? Okay. All right. Yeah. If we're post-surgery, our body's doing a lot, right? Like, whenever we're looking at this, one thing I would say is, like, if you flare up when you start adding activity, it doesn't necessarily mean something wrong with the surgery. It means your body doesn't have the capacity to do the activities you're doing yet. That can very often, like, let's say you're being, I don't know, you're driving a lot and like you're hunched forward, and that takes a lot of muscle strength in the neck to keep your head up, and you feel like that flares it up. What that tells us is, like, we haven't gotten to the healing phase of actually strengthening those muscles enough to do that activity for that long. And that's why it's flared up. It doesn't mean the surgery was bad. It just means that the system doesn't have the capacity to do the activity that caused the flare up. So, when we look at this, it might be that your neck's not ready from a time and healing standpoint for the amount of load, the amount of muscle activation, or even speed, like when we move fast, that's a training. That's part of the healing process that gets into the power component. So like after we strengthen, we need to build like resilience and power in those tissues. We got to practice that, but you can't skip to that step, right? We've got to go through the healing process to get there. And when you do that, that's when we build capacity for the tissue to be resilient. So it's very often not a damage problem when it sounds like this. It's just a capacity problem that we need to, as bad as this is going to sound, like slow down a little bit and build the tissue capacity to handle whatever our activities are, whatever we want to be doing. And just start really slow with that. What we find in our office is you can increase about 5% a week. If you increase 5% a week, you're never going to overload that tissue, and you give it enough time to adapt and get stronger and become more resilient. So that might be 5% in weight, repetitions, speed even. And then we get to a point where it's like, I'm not having this like one wrong thing and it flares up, because I'm making this steady, slow progress with it. I would venture to say if it goes away, like if you flare up and then it goes away, then it tells us like, well, then it's not a surgical issue. It's not like the surgery didn't work. We want to like respect and make sure if it stays and it gets inflamed, like, yeah, obviously go and get checked out, especially if there was an issue. But if it's like a move that causes like a flare up or something like that, I would venture a guess, and this comes with all the disclaimers of like, make sure you talk to your doctor and blah, blah, blah. But I would venture a guess that that's not a surgical issue, that there's nothing wrong with the surgery. The surgery did wonderfully well. I would venture a very heavily weighted guess that this is a capacity problem, that you can get better. There's some weakness in there. We might still have a little bit of inflammation or something like that, so those muscles aren't firing great. There's a muscle balance issue across the neck. Maybe we're tighter in the front and we're not strong enough in the back yet. But it's like, start rebuilding your tolerance and start rebuilding your confidence around that area, so that you're doing all these motions and your neck starts to feel more resilient. For some reason with our necks, we forget that you got to get to the strengthening phase and actually strengthen the neck tissues. So that's something that I would look at. There's a bunch of ways. We put like little stretch bands around people's heads and like do neck exercises. I love the iron neck. Y'all can look that up online. It's a very anatomically correct motions that do a really good job of strengthening all the deep intrinsic muscles in the neck. I do that, try and do it every week. I miss, but it's like, I don't have a ton of neck issues, but I know my neck feels better whenever I'm exercising it. So like, if it was, another body part, if it's my knee, I know I have to get it strong for it to be healthy. For some reason with our neck, even our doctors don't often tell us like, yeah, you need to get the muscles strong again, so it's resilient and can stabilize your neck and we don't have these little flare ups. So, that's the goal, is to get it to that point. So hopefully that helps. You don't need to be perfect. Your surgery is probably great. We just need to like create some slow progression to start making the neck more resilient and build its capacity for like strength and load. So hopefully that helps. Could pain in the shoulder that was previously operated on be caused by the neck? Yeah, yes. That is definitely one thing that we see. And it's always unfortunate if we ever see it, where it was like somebody does a surgery and then like the surgery looks great, and actually like the segment that was repaired actually is functioning really well, but they still have the pain that was there. But other than that, like the motion and the strength and the function gets back in that segment, but there's still, the only symptom is pain, then it's probably that like that was coming from somewhere else. It's same thing as earlier that we were talking about though. It's like, then if we load the structures in the neck, or we move the muscles in the neck, we can identify, is it tissue that's referring pain into the shoulder, or is it that the tissue, the pain generating tissue, was in the shoulder and that's just irritating the neck? We see both of these. I mean, anytime we have like an upper body injury, shoulder, upper back, neck, even jaw, I think that all is so interrelated that we need to get them all healthier together. Sometimes there's like a bigger priority, right? It's like, I have shoulder surgery, I need to make sure I'm strengthening my shoulder. But if I don't have good upper back strength and posture, I'm putting a lot of pressure on the shoulder. If I don't have good neck motion, the nerves that go to my shoulder are not going to be functioning really well, and they're going to be on edge and heightened in their sensitivity. So we treat upper back, chest, shoulder, and neck as kind of this big unit, and all of them get healthier together. So the better my shoulders can move, the better position my upper back is in, the better my posture is, the less stress on my neck, the stronger my neck gets, the better I can move that with less stress on the structures related and nerves going to the shoulders. So, you know, they're all tied into each other on some level. I would say basically every shoulder patient that we see gets some neck treatment. Almost every neck patient we see gets some shoulder and postural treatment, because they're so just intertwined with these things. So great question. Yeah, it is definitely something that we see, and hopefully that's not a major issue in terms of, like, you know, we do a repair and it's something causing the pain that was not part of that. But hope that helps. James asks, should I avoid lifting forever if I have herniated disc? I'm gonna let y'all guess what my answer to this would be. No, not only is my answer no, but my answer is like the opposite. We need to build resilience in the tissues and the disc. At some point with our disc injuries, we start reloading the discs, even with like a hinge, where I'm technically putting, you know, quote unquote, a lot of pressure across the disc. But if we're going to build resilience in that disc, we have to tell the body, I'm going to bend and I'm going to twist. We just need to start with it under controlled environments, so that I can tell my body, hey, I'm going to do this activity, figure it out. So we do like a tiny little dose of it, James, like do a small amount of bending, and even do like 5 repetitions. How do I feel tomorrow? Do some twists. How do I feel tomorrow? And then we just slowly start to load that with more repetitions, with more weight, and with more range of motion over time. And you get to the point where your body has adapted to all that and healed and strengthened and became resilient across the disc even. And then the problem, like, is not the lifting. The problem is that we don't tell the body to adapt and get ready for the lifting. So that's my big thing with it, is like, we don't go from 0 to 60. Like, we break that lift down. So take a deadlift, which, like, there would be many doctors who say never deadlift again if you've herniated a disc in your lower back. And I have had patients that have gone back to deadlifting, like, you know, 300 to 400 pounds after a herniated disc with no pain, no symptoms, no issues. Now, they did that based on a base of strength that they already had before they herniated the disc. And then very slowly, by adding back in little tiny bits, can I get into that position and load the disc? Can I give my body, do high repetitions and do that over, you know, 60 to 90 days to really start to build the tissue response to that? And then can I add a little tiny load and do that over, you know, 60 to 90 days, so my body starts to really adapt to that, and then slowly progress at that like 5% a week, so that I'm going really slow and I'm teaching my body, we're going to do a little bit more, start to adapt, start to strengthen all the stabilizer muscles, start to remodel and strengthen the tissue you've already repaired, so that I can get back to doing, you know, a lift and my spine's resilient and it can handle the load. our body is so good at adapting if we do it consistently and slow, and we very slowly progress in like a safe manner. If we can do these like gentle, safe, slow progressions, you can get back over a long enough time horizon to almost any activity. You could just slowly progress to that. But it's just hard. I see so many people who get like 3 months into retraining this, and they're like, okay, I've been doing this for 3 months. I'm ready to go. So, certainly don't avoid lifting forever, especially if you like, we need muscle and physical strength to stay healthy. There's no way around it. Many of y'all who followed this know I've talked about this. Like, there is such a high correlation with strength and longevity. And so you need lifting to stay healthy. We need resistance training for bone and muscle health and even hormone balance. So we need to get back to that, but you need to do it in a way that doesn't re-injure things. And so break that down. Again, this goes like, get the inflammation and pain under control. Then I need to start getting the motion, the range of motion back. Then I need, like, in the joints and in the muscles. Then I need to be able to fire the muscles without pain. And then I can start strengthening those muscles slowly. And then I can start adding some power in there where I'm adding some speed to it. You can't skip steps. We have to just kind of sit there and go through, and that's biology. But knowing that gives us power to actually do some really good things to heal in the right way, in the right order, at the right time. And when you do that stuff, it's such a good progress that you never really feel like you stagnate. You don't get stuck. But when you go like, yo-yo, where I'm trying to get in and lift like I used to, and then I irritate it, and then I try and lift again, and then I irritate it, and it gets re-inflamed and injured, and I get treatment. I feel a little bit better, and I try and lift. Like, that's when we get really frustrated. But if you just go nice and slow up that ladder, it works really well. So I hope that helps, James. With that, I think that's all the time we got for tea with Dr. D this month. I'll be back in August. And look, y'all can put that on y'all's calendar right now. We are doing August 25th at 6:30. I will see y'all then. Remember, make a little bit of health momentum. Just find those little things that you can do to get a little bit healthier, and just repeat them. And the body does such a good job of continuing to take that momentum into places that you can't even expect right now. So find a little way to build some health momentum today, get a little bit healthier, repeat that tomorrow, repeat that the next day, and you'll be surprised how far you can go with some tiny little actions. So I hope that helps. Have a great night, everyone. Have a great next couple weeks of summer, and I hope it's a little cooler next time I talk to y'all. Have a good night, everybody.